How's your morning going so far?
It's good. It's beautiful out there.
This is Dr. Jeff Hutchinson. And while he's not directly working with COVID-19 patients, the virus has crept into his practice.
Just lately, as a pediatrician, we're talking about the new ways it's presenting with children. And the thing called coronatoe, redness or paleness or a color change, and you're not used to seeing people of color, you may miss it. You may overlook it.
Not getting properly diagnosed is just one symptom of a larger issue. Early numbers are showing that minorities are being impacted by COVID-19 at a disproportionately higher rate.
I saw a really interesting quote from a former colleague a few days ago. He described COVID-19 as almost being guided missiles targeting communities.
This is Dr. Jewel Mullen.
The reason that those statistics don't surprise me is because they very much reflect the everyday circumstances that people live with. As more states and communities are starting to look at their data, they're also starting to identify areas where those impacts might be even higher among some other underrepresented communities.
Speaking of, let's take a look at those numbers from the Centers for Disease Control. Preliminary numbers from the CDC show that 30% of COVID-19 patients nationwide are African American, but African Americans only make up 13% of the total U.S. population. In the Austin area, the disparity isn't quite as high, but it's still out of line with the demographics. Latinos are also being hospitalized at a much higher rate.
One of the things that we're noting is the positivity rate is the highest within our Latino population.
According to early numbers from Travis County, Latinos make up about 51% of COVID-19 hospitalizations, but only 34% of the population in Travis County is Latino. Jason Fournier is the CEO of Community Care Health Centers, and he's noticing this disparity in their testing as well.
The positivity rate for our Latino population right now is at 23.02%. By way of example, for non-Latinos, it's significantly lower at 6.9%.
So why are more people of color in Central Texas getting COVID-19?
The things that we think are simple as public health measures aren't so easy to do. We talk about social distancing when there are many people who are considered essential workers who can't do that.
A recent analysis of U.S. Census Bureau data underscores this issue. In Texas, frontline workers in the pandemic with jobs in healthcare and social services are more likely to be women of color.
The families that I'm working with, the jobs include from food services, fast food, to healthcare workers. These are people who are in more danger. They have a higher risk because of their exposure. I had one patient in particular whose mother tested positive, so if he had the ability, he would quarantine himself. But without any other income, he was really forced to go back to a fast food job. And now other people are exposed to that potential contagious patient. And it's unlike other professions to be able to stay home and work from home when many of my patients just don't have that opportunity if they still even have a job.
High-risk jobs become even more dangerous when combined with healthcare issues. Communities of color have higher rates of pre-existing conditions like heart disease or diabetes. Combined with a lack of healthcare access, it is a recipe for COVID-19 disaster.
Disparities are the disease outcomes that are resultant from inequities that are happening within our community at large. And those inequities are as it relates to insurance status. That's a very big predictor of how someone's life is going to progress and how well they're going to live. This is really about trying to level the playing field.
Even if income and access to healthcare aren't issues, bias and cultural competence might be. Recent studies have documented that assumptions about people of color have led to disparate health outcomes, like the high mortality rate in Texas for new mothers.
We know that there are populations who are treated differently by healthcare professionals. It is part of the bias that we all maintain. And who gets chosen to be tested has been a disparity too, and likely a big source of why populations of color have had higher numbers and worse outcomes than populations that have resources.
Inequities existed before the pandemic. COVID-19 is just a new symptom.
In a pandemic, an infectious disease, or other public health emergency, the people who live most vulnerable every day are going to be sometimes the hardest, if not the first hit by the impacts of the disaster. We're seeing that now with COVID and the way that we've seen it in the past during hurricanes and other crises as well.
Experts hope COVID-19 will finally motivate people to fix healthcare inequality.
We have to move beyond liberal lip service. We have to start talking exactly about what we're going to do about it and realize that they're not specific conversations just about housing or education or about policing or transportation or access to food. They're conversations that rolled up together all impact health. It's about the conditions that people live with. It's not about the virus.